We're back, and it is time for Live Healthy MD, and this is a rock star right here, Dr. Francisco Jacome.
Thank you.
How are you today?
Good.
Yeah, I'm excited about the segment as always. I interject me so that people get a chance to see me, and this is what I've done. I could never say that. I don't have to ever say that I was over 200 pounds because no one would ever know that. That was 26, 27 years ago. Yeah. But I think it's important for me to do that, and you all are doing a great job transforming and saving lives.
It is. It is saving lives. I think, we were talking about right before we started about your weight and how your weight has changed.
Yeah, when I said I was a chunky monkey.
When you said a chunky monkey, yes. I think it's important for everybody to understand that a lot of people feel alone in the problem. A lot of people feel like there is nobody else in the world. Even the people that you see walking around the street that are thin. I can tell you that everybody in the world struggles with food.
Yeah.
I don't believe there is a single person that doesn't.
No, I agree.
Making the right choice is difficult to do it all the time.
Because there's so many choices.
Exactly right. And food tastes so much better than what it did before.
Yes, it does.
Many years ago, there were not as much food, nor the same type of food that we have right now.
Right.
So food is certainly a difference. So I wanted to talk today about the procedures.
Okay, great.
Things that we can do as physicians to help you lose weight when diet and exercise don't work.
Yeah.
So I want to mention that there are two different types of procedures. There are procedures in which we can give you the ability to eat very little.
Okay.
And we call those procedures restrictive, meaning we can restrict the amount of food that you can eat. And we also have procedures that do not only restriction, meaning not only give you the ability to eat very little, but also changing things in your body that will promote weight loss.
Really?
One of them is energy expenditure. So the procedures that we consider them weight loss are procedures that you have it done and the weight loss is guaranteed. You will start losing weight immediately after the procedure.
Oh my God, yeah.
And again, those are procedures that carry complex changes inside your body that will promote this. But on top of that, they also promote, like we said the last segment, diabetes cure, hypertension cure, meaning blood pressure problems cure, cholesterol cure, sleep apnea, and so on. Today, I want to talk more about the procedures that only give you restriction.
Okay.
So within these procedures, we have pretty much three are the main ones, the most common ones. People are already hearing a lot more about the gastric balloon, which it seems to be brand new here in the United States, when in reality it's been out. It's been being done for over 20 years outside the United States.
Wow.
So, and actually on the late 1980s, there was a gastric balloon that was used here in the United States that ended up going away.
Okay.
But now it has come back. So there are two types of gastric balloons. Number one, I want to mention that to place a gastric balloon, it does not require surgery.
No.
We can do it. We can do it through endoscopy. A lot of times, I like to explain because people don't know what an endoscopy is. So, but everybody knows what a colonoscopy is.
Yes, we do.
Yeah, but don't forget about colonoscopy. So, I want to mention that endoscopy is about the same thing, but not from behind.
That side, yeah.
It's from from the side above. So, pretty much, the patient, gets medication, goes to sleep, and we can place the balloon endoscopically.
Wow.
Two types of balloon. One is a single balloon. It's just one balloon that goes inside the body, and the other type of balloon is a double balloon. So instead of being one, there is two balloons, smaller, that go inside the body. Very important to understand that this procedure is a procedure that is meant to change behavior. So by getting this, the patient gets the sensation of fullness, which allows the patient to eat a lot less. And that, along with the behavior change with exercise, it will create successful weight loss.
Yeah, and when you get full, your brain gets the signal that we've eaten, and we've eaten enough.
Yes. So you have the sensation of fullness. You don't want to eat a lot. At that point, the hunger is usually the thing that makes us choose the wrong things to eat. I know it's very redundant, but if you're hungry, you can't control what you're going to eat. You just by impulse get something that will give you immediate gratification.
A Twinkie, a donut, or whatever. Yeah.
Donut, right. So the other procedure that I want to mention also that creates this is something that was very popular before called the lap band. Lap band The lap band is a plastic ring that goes on top of the stomach that creates pressure. It kind of divides the stomach like an hourglass,
Okay.
if you want to think about it. And the pressure that is created with the lap band on the stomach is what sends the signal to the brain saying, I am full.
Wow.
And instead of the balloon being inside, occupying space. So there are 2 procedures do not require surgery, but again, does not give you weight loss. It helps you modify behavior.
It helps you modify behavior, and that's key. But my question is, Live Healthy MD, with all the procedures that are available.
We offer all of them.
Cool.
We have all of them available for our patients. And when you come to see us, we will go over a ton of details on what exactly they mean and how they work.
Wow, awesome. I learned a lot today. I really, at the end of each segment, I always let you know how much I appreciate.
I appreciate the opportunity to be able to transmit this to people that don't know.
Exactly.
Because it's very important.
It is, and because I've been in their shoes, I know how important it is. I was fortunate that I wasn't diagnosed with diabetes. I was fortunate that I wasn't diagnosed with high blood pressure or cholesterol or any of those other diagnoses that's related to being overweight, in my case, obese. It was a miracle, but I know how you feel. And I know that you all you are making a difference.
We want to.
You do. We're going to go to a break. We'll be right back after the break. We want to thank Dr. Francisco Jacome, Live Healthy, MD, Augusta, Georgia, Dublin, soon to be in Macon, and in a neighborhood near you. We'll be right back after the break.
We are talking it up.